The Biden administration has announced price reductions for 10 prescription drugs under Medicare, a measure required by the Inflation Reduction Act. With the new pricing, the administration is expected to total save $6 billion for taxpayers and $1.5 billion overall for some of the 67 million people who rely on Medicare. However, details on how these savings were calculated have not been disclosed. The White House also couldn't provide an average savings estimate for individual Medicare users who take the medications. The Act encompasses a wide range of domains. It aims to lower healthcare costs by allowing Medicare to negotiate drug prices, include incentives for clean energy manufacturing, demo projects, technology loans, and tax credits, and implement tax reforms to reduce the federal deficit and curb inflation. In an event in Largo, Maryland, President Joe Biden said,
"I've been waiting for this moment for a long, long time. We pay more for prescription drugs. It's not hyperbole. We pay more for prescription drugs than any advanced nation in the world."
Vice President Kamala Harris said,
"So all of this is to say, 2 years ago as Vice President, I was proud to cast the tie-breaking vote that sent the bill that gave Medicare the power to negotiate and let it get to the president's desk, and I was proud when our President Joe Biden signed that bill into law. In the 2 years since, we've been using this new power to lower the price of life-saving medications."
According to the U.S. Department of Health and Human Services, about 9 million Medicare prescription plan users take at least one of the 10 negotiated drugs, which means they benefit from reduced prices. Medicare is a federal program serving over 65 million Americans aged 65 and older, and some disabled individuals. The new prices will reduce the list price of these drugs by 38% to 79%. These prices will be implemented starting in January 2026. US drug prices are significantly higher than in the UK, France, and developing nations like Pakistan due to less price regulation and higher research and development costs. Januvia, Jardiance, Farxiga, Fiasp, and Novolog are commonly used for diabetes. The prices for these medications have significantly dropped, with Januvia decreasing from $527 to $113, Jardiance to $197, and Farxiga with a 68% reduction, now priced at $178.50. Fiasp and Novolog will see their prices fall from $495 to $119. However, even with these reductions, the costs of these drugs in the US remain high compared to developed countries like the UK and France, and developing nations like Pakistan. The prices for heart failure drugs, Jardiance, Entresto, and Farxiga have dropped from 53% to 65%. Drugs that target blood clotting like Enbrel will decrease from $7,106 to $2,355. It is priced at $115.38 in the UK, $415.68 in France, and $91.28 in Pakistan. Imbruvica, used for blood cancers, will see its price decrease from $14,934 to $9,319, a reduction of about 38%. In comparison, the drug costs roughly 62% less in the UK, 49% less in France, and 98% less in Pakistan. The important question here is why drug prices are so much higher in the United States compared to other countries. Americans have the highest prescription drug costs globally. In other wealthy countries, a single entity, usually the government, negotiates drug prices with pharmaceutical companies, giving them stronger negotiating power. In contrast, the US has many health plans negotiating separately, reducing overall bargaining strength. Additionally, other nations evaluate the added benefit of new drugs compared to existing ones and assess their cost. If a drug's price is too high for its benefits, these countries are more likely to reject it. Some countries, like France, impose limits on drug spending. If sales surpass a set limit, the government receives a rebate. In the US, drug companies are not subject to legal price controls for patients with commercial insurance or for initial drug prices when a drug first launches. High drug costs benefit not only drug companies, but also doctors, hospitals, and various intermediaries. all of whom get a share of the profits when prices rise. This year, inflation has slowed, but the price increases since the COVID-19 pandemic continue to affect consumers. Over the 12 months leading up to July, consumer prices rose by 2.9%, with prescription drugs seeing a similar increase. After the announcement from the government, drug makers Johnson & Johnson, Novo, and AstraZeneca expressed opposition to the new discounts, arguing that they might not actually reduce out-of-pocket costs for patients and could potentially stifle future innovation. The president of the lobbying group Pharmaceutical Research and Manufacturers of America, PRMA, Steve Ubel, released a statement saying that the administration is using the IRA's price-setting scheme to drive political headlines, but patients will be disappointed when they find out what it means for them. There are no assurances patients will see lower out-of-pocket costs because the law did nothing to rein in abuses by insurance companies and PBMs who ultimately decide what medicines are covered and what patients pay at the pharmacy. According to the White House, every year more drugs will be included in Medicare's price negotiation program. In 2025, Medicare will choose up to 15 more drugs for negotiation, followed by up to 15 additional drugs in 2026, and up to 20 drugs annually thereafter.